This show is sponsored by PowerfulWomenUSA.com, a place to be inspired by successful women. Hey, everybody, I'm Jill Conway, and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. I'm hoping you will be inspired to pursue your dreams, reclaim your voice, and discover your strengths. So guys, my guest today is Dr. Roxanne Carfora. She is a medical doctor, founder of Ageless MD here on Long Island, and she specializes in anti-aging, restorative and functional medicine, hormones, and menopause. Yes, indeed. So she is the author also of her new book. It's called Stress, Gut, and Immunity. She's working on another one, and Dr. Carfora is here. Thank you for being here, and welcome to the show.
Oh, thank you. Happy to be here.
Oh, well, all right. So let's begin. All right. What exactly do you do? What is, functional medicine, anti-aging, what is your,
yes.
What is it?
Okay, so what that all is we look at things at the cellular level. So that's the cell, every single cell in your body makes up organs. Those organs make up a system, and that's you. And we start from the inside of the cell out, where regularly years ago we would start from the outside in, just treat disease and treat. We find out the root cause, correct the underlying nutritional depletions and hormonal depletions.
So, what happened? What did you always want to be a doctor? How did you get to this study? How did you get here?
Oh, I always did want to be a doctor. So I first learned when I took care of a bird that actually fell out of its nest. And I was on the farm with my uncle, and I stayed there for the summer, and he taught me how to take that leg and tape it up and then bring that little bird to health, and then we got that bird to fly away. And at that time I was 9 years old, and I said, Uncle Tom, I want to do that.
Oh, wow.
Yeah.
So what happened? You went to school for it, and you decided then? Take us through, in case someone's listening and says, you know what, I'm thinking of being a doctor. What's your path? How did you get there?
So I always, again, knew when I was younger. And then when I was in school, I didn't think that I could go to medical school. I came from a middle-income family. I was concerned about the income. My family couldn't afford it, so on and so forth. So I started out as a medical assistant. And I worked for Dr. Lowell. So if Dr. Lowell is listening out there, thank you. You know that you are my mentor forever. And I worked in a doctor's office as a medical assistant. And I was with him for 11 years. And, he encouraged me to go to medical school. And he would say, just as I was speaking to someone outside who wanted to be a doctor, and now she's a biology teacher, but she's considering medicine again. And I said, do it. If the passion is there, do it. Don't worry about the income, the money, the loans, because it all comes to when you love what you're doing. And so I started out as a medical assistant, and then I went to undergrad school. It was really hard, like organic chemistry, and that's when I find a lot of young people go, I couldn't get through that. But I learned to take that during the summer, so it was my only summer course. And then got through undergrad and then applied for medical school. At first, I applied to PA school, so I was a PA first.
Right.
And then I was telling you outside, I went on an interview, and the doctor said to me, why aren't you being a doctor? And I said, it just takes too long. And and he said to me, well, you're going to be 33 a doctor, or you're going to be 33 wishing you were a doctor. So which one do you want? And that's when I just said, you know what, I'm going to medical school.
Wow.
Yeah.
All right. And then so you went into, when you became a doctor, you went through the residency and all that stuff. Then you went into your own office, or what did you do?
So I was first an emergency room doctor for 3 years at St. Charles Hospital.
Wow.
Loved it. Learned so much there. Then I worked with another doctor who picked me up from the ER and said, hey, you'd like to go into private practice. So I went into private practice in Mount Sinai on Long Island, and I was with him for about 2 years, and then decided I wanted to go out on my own because I wanted to do things my own way.
Sure.
So, when I went out on my own, I was board certified in family medicine. So I did my residency in family medicine, was an ER doc, went into private practice for a couple of years, and then went out on my own in private practice.
And then that led you to anti-aging?
Yes. Yeah. So back in 1998, that's how old this is, right? A French woman came into my office and she said, how come I can't get bioidenticals here in America? So I went, what are bioidenticals? So I had no idea. Right. So, and she told me, and I said, educate me. And she connected me with, at that time, it was 2 Olympians in California. Suzanne Summers was the one that was bringing it. Remember her book? I
have her book.
Remember her book, Ageless?
Yes, I still have it. Yeah, yes. God rest her soul. Yeah.
God rest her soul, and totally a mentor to all of us.
And people thought she was crazy.
They thought she was crazy. There were 42 of us initially where we were being taught by scientists and doctors, and 2 Olympians that were going outside of the United States and going to European countries to get themselves better so that they could repair their muscles, so on and so forth. So I was I was the first graduating class. There were 42 of us of anti-aging and functional medicine.
Oh my gosh,
that was back in 2004.
Wow. Yeah. All right. So functional medicine, like you said, is looking for the root and how to prevent illness.
Correct.
Which I think, that you had to go to a specific field to do that. Why don't we do that for medicine? And why doesn't everyone do that?
Yeah, so nutrition is not taught in medical school, except if you go to an osteopathic school like I went to, New York College of Osteopathic Medicine. You get 500 more hours of nutrition and the musculoskeletal system. So when you're dealing with people with, athleticism and maximizing the body's, workload and feeding that workload, you have to know nutrition and you have to know body mechanics.
Right.
If you don't know that plus medicine, you're really not getting the gist of really what the body's capable of doing or what your cell is capable of performing for you.
Well, let me ask you this. It seems like a very basic question and you might laugh, but how important is the food we eat to how our body functions? Because some people say, I can eat anything and I feel great. And people like me say, whatever I eat affects me dramatically. So
another old saying, Hippocrates, right? Let food be thy medicine. And really, let food be thy medicine. Our food has been over-processed, over-farmed, insecticides, pesticides, and you can hear all the influences out there, getting out there and educating, which I love that, because I think more so with me being this kind of medicine since 2004, we never had so much buzz about it.
Right.
And I love it. And, it went from functional medicine to anti-aging, regenerative medicine, now to personalized medicine. So the name has changed several times because there's functional medicine where there's chiropractors out there that they're functional just for body and some nutrition, but truly anti-aging regenerative medicine is really looking at everything from the inside out.
Wow. So, okay, so let's talk about, because we'll touch on this, but I do want you back for another show. But I can tell already. You have stress, gut, and immunity. Your gut is your immunity, and that is your book. People, that it still shocks me that people don't know the mind-body connection, right? That what stress can do to you. And a doctor once told me that everything is caused, is by inflammation. Right. And stress causes, I guess, the whole body to become inflamed, right?
Correct.
The mind-body connection, talk about that. Well, how important is that?
So, with the mind and body, cortisol, which is your stress hormone, that is the number one thing that is affected by stress. Now, stress could be emotional, it could be physical, and it could be environmental. So granted, we live in a very toxic environment, right? And then you add other things on the body that are also causing stress, such as immunizations, like excessive immunizations. The book that I wrote, Stress, Gut, and Immunity, was based post-COVID. And, I spoke about this also, on future shows, past shows, just in reference to when you're exposed to a stressor, whether it be the physical, environmental, or psychological, it hits the gut in the area that's called toll, T-O-L-L, receptors. Behind those receptors is your immune system. So when you get excessively stressed or you're exposed to a virus or a bacteria, again, those toll receptors get weakened. And now your immune system can't protect you. So you've heard about leaky gut?
Sure.
Right? So this is autoimmune gut. It's past the leaky gut. So your body can't differentiate what's going into the gastrointestinal system to say, oh, that's a bacteria, you better not come in here.
Right.
Oh, that's a nutrient, come on in. I need your D, I need your E, I need all of these nutrients and minerals. So the toll receptors selectively bring in things that's nutritionally great for you, and it pushes out things that don't belong there.
So,
and that's what stress affects.
Right. So, okay. So, yeah. So what about, I mean, how do you feel, since you brought it up, how do you feel about all the immunizations that kids it's some outrageous number that kids get before now the age of 1 or 2 or 3. I mean,
100%. You know, I'm a grandmother of 4, love my grandchildren. My children were vaccinated when they were younger, but there's too much load on a little body. You know, the brain development is up to 2 years old. So, you know, these things that affect the brain on that child or affect those toll receptors in the gut, like that baby's gut isn't even developed yet. You know, we don't usually put, you know, table food until years ago it was a year old.
So
right?
true.
Right? Now it's different. Now they get table food into them when they're 6 months old. You know, and I just think of all of those allergens or food chemicals that are getting in them, and then thinking of their gut's immunity, and then they get vaccinated on the average, what is it now, 22 vaccines by the time they're 6 months old? And they'll do like, oh, let's do the multiple one that has 6 in there.
Right.
I'm just in such disagreement with that. And I do, you know, I recommend vaccination for things that aren't treatable, right? Like the whooping cough, right? Polio, right? We couldn't treat those things.
Right.
But we could treat the flu. We could treat COVID. And we did and were able to treat COVID when it was released. I repeat myself. Okay, it was
kind of
treatable.
Hidden. Yeah, that was hidden.
Yeah, it was hidden. It was hydroxychloroquine. Yes, people, hydroxychloroquine treated COVID. I'll say it loud and clear because I was in an infectious disease conference when COVID hit this country. And hydroxychloroquine was recommended on the board. I have videos of it. I have proof of it. This is what you do. Hydroxychloroquine and steroids and an inhaler. And I did that, and thankfully, God, my practice was a very healthy practice. It was about early treatment rather than vaccination.
Which is, and now people are still getting vaccinated for it.
You know, build up the immune system. That's what it's about. And if you're going to if you look at all the vaccination data right now, when it initially came out, they said, oh, the COVID vaccine was 92% effective. And it's down to like 6 to 8% now. And the more vaccines you get, the more you're altering your own immune system. And it does depend upon the vaccine. A messenger RNA. Now, listen to that word, messenger.
Right.
RNA is in your cell, just like DNA. Why would you want to message your cell to produce spike protein? It's beyond me.
Well, because didn't we think years ago that the body couldn't really heal itself? Like, you know what I'm saying? Like, to me, I think now your body can heal itself. And I think the amazing qualities it possesses, really, we haven't even scratched the surface, right? But most people don't feel that way. They run to the doctor, not you, but they run to a doctor and they just, in and out, here's a drug. Here, take this prescription. You'll be fine. And are you fine? Maybe, I guess, if it's if it's some sort of heavy hitting, if you're really sick, if you have a bad infection. I'm not saying that, we all need,
of course, medicine.
Yes. But I mean, the little things that, maybe changing your diet would fix, or things like that.
Yes. And it always is food first.
Yeah.
To me, this is what I tell my clients: food first, supplements second, medicine last. Right. Not all medicine is bad, of course. Medicine is such a great field. Right. That's why I went into it.
Right.
But when you go into medicine, you really have to understand the body, how the body functions. And that cell functions on food. It's called the Krebs cycle. You remember that biology major? Okay, so listen up now. You're going to get a lesson on the Krebs cycle. So real fast, remember how they used to do all those things, right? So, I have to remember this stuff? Oh my Lord, oh my Lord. But the Krebs cycle is simply 3 things. You need to eat well, right? You need to break it down, and you need to take the nutrients that are on that in the Krebs cycle, which is mainly your Bs, your magnesium, and CoQ10. That completes the cycle.
So what if your body can't break it down? What if you have problems digesting?
That's it. That's why I wrote the book, Ageless Gut, The Inside Story, because yes, you're right. As we get older and our hormones decline, our teeth, our dentition, our saliva, our esophagus, there's the tube, the muscle tube that brings the food down. Everything weakens because testosterone goes down, which feeds muscle. Estrogen goes down, which gives us our nice saliva, our taste, our smell, our vision. It's a lot more than just a sex hormone, right? So all of those things too, when you balance them, you're increasing your body's ability to fight off infection, to digest food, and to absorb it into the cell. And you could check the levels too.
Right. You can check the levels of how you're digesting the enzymes, I guess. Is it the enzymes?
Yes, you can. You could check enzymes, your vitamin D, your Bs, your CoQ10, all via blood work.
What would you say? I mean, there's so many chronic diseases and illnesses out now that people just say, I have this and I'm never getting better. Is that a fair statement? I mean, that's how they feel, and I understand that. I'm not belittling anyone who says I have this disease, and I wish I could get better. I wish I could get well, but doctors giving me, one pill after the other.
Yeah. And, that's when you have to look at the cause. The first thing, like you mentioned early on in the show, stress hormone. Right? Check the cortisol level. You could get that checked also. You check your cortisol level. Cortisol is your own body's anti-inflammatory. And if you're excessively stressed, and again, all 3, physical, emotional, and environmental, if you're stressed by anything like that, then it's going to knock down your cortisol, which is your ability to decrease inflammation, to fight disease, to increase your immune system. So it is your fight or flight hormone, and it's essential. You can't live without it.
Well, then we go back to the mental health issues, which cause a lot of stress. How we feel about things going on in our life, and maybe instead of the Xanax and the Prozac and all these things, we have a better, environment where we can talk out our problems and why we're feeling the way we're feeling.
Yes. And that is the stress of the environment, right?
Yeah.
So a lot of people, the whole issue about being kind and loving to people. And, I get sometimes pulled away from the homeless people, like just last week I saw a homeless guy and I went up to him to give him, I had 2 protein bars in my bag. So I went to go give it to him. He goes, I don't want that. I need a bathroom. I said, okay. But you try, right? Yeah. You try. I thought he was hungry. He was going through the garbage pail. And I thought he was hungry, but he was looking for a garbage pail. But needless to say, he was drunk. Right. So, but you just, you be kind to one another, be aware of someone's stresses. I always tell anyone, your smile may be the first smile that person saw today. Right. And it's so upsetting to see people just bypass people. Yeah. And just a simple hello or opening a door or just really recognizing those stressors on a person's face is like, that sometimes people just need a hug. That's why I said I'm a hugger. Yeah. Right? I hugged you. I'm a hugger. Yeah. Because hugging releases another hormone called oxytocin. Makes you feel great.
I didn't know that.
Oh, yeah.
Oh, my goodness.
That's your brain hormone for cuddling, feel good, loving emotion. So hug away.
Oh, I didn't know that. Wow. All right, we only have a minute and 30 seconds left. I don't know how it goes this quickly, before the next half, but if you had to take 1 vitamin or 2 vitamins, what would you take?
Vitamin D and Bs.
Why?
Okay, so vitamin D is for your immune system. It's a pro-hormone. It prevents infection. Okay, real important. It's not only for your bones. If you're depressed, if you feel tired, you can't get up out of bed, it's probably D depletion. Number one deficiency in my practice that people come in with. Wow. That is a total, like you could just take D and you'll be good. And your B vitamins, because most people, it's brain. So the B not only feeds the cell cycle of every single cell in your body, but your brain. It's your focus. And that's also your get up and go. So B and D.
Oh, my goodness. Okay. We are coming back with Dr. Roxanne Carfora after the commercial break. You're listening to Secrets of Powerful Women. If you love what you're listening to, head to powerfulwomenusa.com for previous shows, or you can find my podcast on whatever platform you listen to. Share this with a friend because this is so good. We're coming back. Welcome back. You're listening to Secrets of Powerful Women. Dr. Roxanne Carfora is with me. Dr. Carfora is a medical doctor with a specialty in anti-aging and restorative medicine, functional medicine, hormones, and menopause. And yes, ladies, we are getting to menopause, but we're getting questions in first. So I wanted to all right, Dr. Carfora.
Yes.
Over-supplementation. Is it possible?
Yes.
Okay.
So that is why I recommend getting your blood levels done. You could check every nutrient in your body. And I tell people always, quote unquote, know your levels, know your body. Mm-hmm. Don't just take that. And you're right. People come in with bags of vitamins. If you're taking bags of vitamins, something's wrong with your gut and you're not absorbing. So again, it's always food first, supplement second.
Ooh, okay. Let's talk. We got a question in about Ozempic, the weight loss drugs.
Yes.
Good, bad?
No, when used appropriately, they're good. And they're very good when used appropriately. But what happened, I think they just got out there and people were using it to lose 10 pounds. But if you have someone who's insulin resistant, someone with polycystic ovarian syndrome, people with total imbalance, and you need to get that insulin down and you need to get that sugar down, I truly love those medicines for that. But again, use it appropriately and be monitored and make sure your vitamin D is good. A lot of people taking this medicine, vitamin D is your receptor for insulin. So vitamin D stimulates insulin receptors, okay? So if you have high insulin and you have a low D and you're taking your Mongeros or your Ozempics and your D level is low, you're not going to get the outcome that you would want if you were increasing those insulin receptors with vitamin D.
Okay. So now I want to jump into menopause and hormones because it's a big deal. And I know I'm postmenopausal, so I am. This is what I want to speak to too, because you're fascinating in everything that you talk about. So first off, okay, perimenopausal, menopausal, and then postmenopausal. What is the difference? And it just seems confusing to me. When are you actually in menopause?
Okay,
go.
So when you're actually in menopause is when you don't have a period for a full year. Okay, so starting with perimenopausal years, those occur 35 to 45 years old, roughly. So the first hormone that drops in perimenopausal years is your progesterone. Your progesterone is your calming, relaxing hormone. So when that goes down, people become very irritable. They become irritable, they may have palpitations, they have insomnia, they can't deal with any stressors. Now, progesterone, your calming, relaxing hormone, is your backup hormone for cortisol, your stress hormone. So when someone's excessively stressed and they're between the ages of 35 and 45, it could really do damage because now you're going to have the progesterone going even lower, getting more symptoms of low progesterone. Again, anxiety, palpitations, insomnia. I call it like you get really itchy and bitchy. So you get witchy, get out of my way, and all of that. So, so that's the 35 to 45. From 45 to 55, which are your menopausal menopausal years, those you start to drop your estrogen. Okay, so now going from 35 to 55, if your progesterone drops faster than your estrogen, you become very dominant in your estrogen hormone, which will give you heavy bleeding, fibroid uteruses, okay? Uterus, okay? But
Which
you'll
means
get
what?
fibroids. So fibroids are thickened uterine tissue, and you'll form benign tumors around your uterus. And that makes you bleed heavily. And often women have to get a hysterectomy because they're bleeding heavily.
Right.
But no one's checking progesterone, which could also balance that, or metabolizing their estrogen, which usually is B vitamins.
So, wow. So, someone told me that you don't really study this kind of stuff in med school, right? I mean, how much time is spent on this for the doctors who are in med school nowadays?
Well, if you're an obstetrician gynecologist, you have a big textbook at home that tells all this.
Okay.
But unfortunately, when doctors get out of medical school, they're taught just prescribe. We're in a medical world where everything is rush, because it's a business, and we don't have a health care, issue in this country. We have a health insurance issue in this country. And it angers me that people say, the healthcare system. We have the best healthcare system in the world, in the United States. But our health insurance system has to be revamped.
Yeah.
Because people are paying money for insurance. Hospitals have to stay in business, so they do excessive testing and excessive this, just so that they can make an income to stay in business. It shouldn't be like that. It's got to be totally revamped, go back to the old way, where you had indemnity plans, they were called, where you just paid $250 to $500 a month for hospital, period.
Right.
And keep people healthy.
Right.
Because it's a very sick model. Yeah.
Let's talk about, you mentioned briefly HRT, right? When I was younger, and the whole, Suzanne Summers, people thought if you take, soy and all these things, estrogen, it'll cause cancer. That's a big one. So what do you say to that?
Okay. So estrogen doesn't cause cancer. It is the imbalance of hormones that cause cancer. And it's how you metabolize estrogen and your genetics. So if you have a BRCA1 gene that's positive, everyone should get that done. If you have breast cancer in your family, get a BRCA1 gene done. And if you have a BRCA1 gene, then make the decision on how you would prevent things from happening. The study that they did years ago with the estrogen, they used to give women just estrogen. And they said even if you had a hysterectomy, you just would need estrogen. But every single cell in your body functions on estrogen, progesterone, testosterone, cortisol, and DHEA. So when you take estrogen, you should be taking also progesterone.
Right.
And there's a lot of gynecologists that might be out there going, that's not true. But I've practiced both family medicine, I've practiced regenerative medicine, anti-aging medicine, functional medicine, and it is true. Because I could tell you I have thousands and thousands of patients that were treated, but not only me, throughout the United States.
Right.
We have checked people's estrogen, progesterone, testosterone levels.
Wow. All right. So let's talk, I'm going to do some questions for you. Okay. So what age does menopause, I think you answered this already, typically start?
45 to 55.
Okay. And with some people, perimenopause, you said 35 to 45.
35 to 45 perimenopause is when you're starting to drop your progesterone.
Yeah. And you get extremely heavy periods. I apologize to any of the men who are listening that say, I don't want to know this stuff. Don't turn it now because it's going to get real. So when you have I have a story for you. I was out, and I was going through all of this, and I call it the flush, right? Okay. The big deluge. When you get up from a seated position and, oh boy, you have to look at your chair to see if you're leaving, something behind. And I know that sounds gross if you haven't been through it, but it happens, and it happens to a lot of women. What is that? That's just part of it. That's part of, or like you said, that's one of the hormones just going crazy.
That's right. That's estrogen. That's mainly when estrogen is so high and you're not metabolizing it, that you're overstimulating the uterus. So the uterus fills up with blood, and every month you should have a period, and that blood should exit from the uterus.
Right.
But what happens when you have excessive amount of estrogen, it deposits in two places, mainly two places, your breast and your uterus. So the thing is to get those estrogen levels checked to see if you're estrogen dominant. And if you are, you need to metabolize that estrogen. And again, we check all those other nutrients, right? Your Ds, because D is a prohormone. It balances them. You know, you have to check your Bs. Bs metabolize your hormones, estrogen, progesterone, all of it. And again, if you're excessively stressed, think what happens.
Which everybody is, right?
That's right. So the stress is pulling the progesterone down, which is making you estrogen dominant. And where's that estrogen going to go? The uterus and the breast.
Oh, wow.
Yeah.
Okay. Wow. Okay. So, first signs of symptoms of menopause. We know about the hot flashes. Everyone talks about that, but there's so many.
Oh, yeah. So as far as when progesterone drops, again, the irritability. So you had mentioned men. No, men, listen. Because if your wife is between 35 and 45, she's dropping her progesterone and she will be a witch.
Yeah.
So don't, take it personally because that is a woman's hormone starting to decline. And if you recognize those symptoms, you could tell your wife, get your progesterone level checked. You might be perimenopausal. But it's so great. But you know what? If the more knowledge the men have, too, you could actually, we have a saying, save the marriage.
Right.
Because it becomes so, where people around that individual, I call it a family disease. It's not just perimenopause and menopause, it's the whole family's disease. So that individual is going through it, but so is the family, right? So then when you go into the menopause, again, it's the estrogen. So if the estrogen is becoming high, you're going to get that heavy bleeding. But estrogen has over 400 functions in the body. So I'll start from the head. Okay.
Go.
So your brain declines, your vision declines,
Yeah.
your taste and smell changes, your saliva starts to decline, your throat in swallowing, your esophagus going down into your gut also declines. Motility of the gut declines. And within the first year of menopause, your cholesterol goes up, LDL cholesterol. That's why we have the red dress month for women to get cardiovascularly checked. Huge. Yeah. So when your estrogen is going down, LDL goes up. So it's reactive to. It's not, I'm eating poorly, right? So how many people out there say, I'm eating well, I'm exercising, but my LDL cholesterol, my lousy cholesterol is high.
Yeah.
It's because your estrogen is declining. So it's all of those factors plus your bones. Okay, so you could go from inside out. And estrogen is very, very important.
I think for me, one of the worst symptoms has been brain fog.
Oh, yeah.
Oh boy, you really. I mean, my kids would laugh, my husband would laugh, but I consider myself a fairly intelligent person, and there were times, you just, I don't know what happens. You just I can't remember anything. I don't know why I came into this room, right? I don't know where my keys are. And you're like, what is happening? I'm getting stupid and I don't understand why.
Yeah. It's estrogen. It's profound when it comes to memory. There are people that really decline in memory. And I have many stories, with that and just correcting it. So it's not just hot flashing, people. It's not about hot flashing and vaginal dryness. And that
and low sex drive.
And low sex drive.
Yeah.
Just like men drop their testosterone, it's similar. And if you're vaginally dry or if you have dry saliva in your mouth, you're vaginally dry. And if you're vaginally dry, you could do non-hormonal things. You don't have to take estrogen for that. There's so many different things that we can do non-hormonal.
Wow.
Yeah.
Wow. Okay. So, and menopause can last how many years?
7. So your symptoms?
It's terrible, by the way, right?
Okay.
Oh, gosh.
So hold on to your seat now. And this was studied. 7 to 10 years your symptoms could last. Can you imagine?
That's punishing.
7 to 10 years.
Yeah.
So if your period stops at 50, you're talking, but most women today, they do get help. There's a lot of herbs that you could take out there. There's nutrients that you can take. So again, it's not all about hormones.
Right.
It's about balancing that cell, from the inside out, nourishing that cell. So everything around it is balanced, dietary, like we spoke, right? Food first, supplements second. So getting all of that together and using some herbs for hormones.
What about, I mean, because years ago, I guess women just suffered through it, right? I mean, do you have situations where your patients just choose to like, I'm not doing anything, I'll suffer through it? Do they do that anymore?
Very rarely, but, you know, some women will come in and say, you know, I don't want hormones. It's not for everyone. Yeah. And again, everyone you don't have to take hormones. There are other things that you could do. Exercise reduces, you know, your hot flashing and stuff. So being on a really good exercise regimen with a good dietary regimen, and again, balancing all of those other nutrients could truly balance someone and make it better going through those years. What about intermittent fasting? How do you feel about that? Yeah, I love intermittent fasting, especially if you have to lose weight, and sometimes if you're an athlete. I like when you stop eating around 7 o'clock at night and then pick it up about 10 a.m. because that's also where you're banking your cortisol at night. So you don't want to really start, you fast at 10 in the morning and don't eat until 11 o'clock at night and have one big meal. Right. So you do want to fast during the night. Okay. All right. Let's see. Can I still get pregnant during menopause? Oh, no. So if you're menopausal and it's been done, you're good for a year. However, if you are menopausal and you are on hormonal replacement therapy, okay, I had one case that did get pregnant, and she was 52 years old, but she was on hormonal therapy from 45 and older to try to get pregnant. So I really think that just kicked in, but she was very happy. She had twins. Wow. So she was very happy. But, again, if you have to make sure, your ovaries in general, from 38 to 48, your ovarian function drops, per year. So, you really want to try to have your children between ages 28 and 38, and the earlier the better, the more success you'll have. From 38 to 48, your success rate of pregnancy goes down. I'm going to tell you a personal story of mine. I'm postmenopausal, or so I thought. But 17 months later, I was in a plane. I got off, got a heavy period. Again, lasted about a week. Went to the doctor. They didn't know what it was. They gave me a drug to stop the bleeding. And then I went through all the series of tests to see what it could be. And they didn't find anything. And the doctor said, I love her, but she said, sometimes the body just gets shaken up and we don't know why, what causes it. Is that true? Yes. So correct in saying shaken up, but it's cortisol. So think about that time when you were on the plane. Was it one of the most stressful times in your life? Was it something that you didn't sleep for a week? You were traveling for business. You were excited about doing something, and so on and so forth. And if you were just out over a year of not having a period, and say it's, 16 to 17 months or so, you could still bring that period on if you were excessively stressed and you didn't have enough progesterone. Wow. Yeah. I find that so, and that's what I find so shocking is that women's like, well, it could happen. And I was like, I've never heard this before. No one talks about this before, at least with me, because I still feel like sometimes people don't want to talk about it. They don't want to talk about it. Now, I think the conversation is growing, as we've seen now all over social media, and all the people are talking about menopause and how it's so important to finally come to the forefront and talk about. Yes. So all right, let's talk about another thing. I read about electric shock sensations during menopause. What is that? Zings. That's usually estrogen dropping. So it's neurological. So again, estrogen, it functions in the brain. So, people talk about, again, their zings or, electrical current going through them and stuff. Because again, your body has had hormones from when you're 12 years old up until 50. And your stressful situations in life from that age group, 12 years old to up to 50. Think about all that your body goes through that time period, right? Yeah. And then all of a sudden at 50 or late 40s, your hormones, you start to lose estrogen. So again, estrogen is gone, and that's your balancer. Progesterone's your calming agent. Estrogen, again, over 400 functions in the body. Cortisol starts to drop.
Right.
Again, that's your adrenal gland. So everything starts to age, and we age endocrine-wise first, which is ovary, adrenals, brain, digestive. This all slows down on us.
Wow.
Yeah.
Oh, make it stop.
I know. Make it stop. That's anti-aging medicine. That's ageless. I love it. I love it. We can make a difference. We can.
Yes, we can. To age gracefully, right?
Yes. And more personalized too. So if a person comes in and doesn't want hormones and wants other things, there's so many things. The difference, like with hormonal replacement therapy that you get from the pharmacist and compounding it. Like I work with the compound pharmacist since 1998 when I first started learning this. So you compound what that person needs. Do they need estrogen? Do they need progesterone? Do they need testosterone? Do we need a little DHEA? Do we not need any of that? Do we need a little hyaluronic acid? Could we put a little bit of estriol in there? So there's all different ways of doing it.
What about collagen? What about taking collagen?
Yeah, so collagen's a great protein, right? I like colostrum better because it's really good on the gut, and it gives you immune cells and growth factors and what's called peptides for muscle strength. So collagen's a large protein. So if you don't have a good gut, or your gut was attacked by something, you'll get bloating, distension, and stuff. But that's a good one. And I like marine collagen, so
because that has coenzyme Q10 or something.
Yeah. And just the fish from
fish oils.
The ocean, the fish oils are great.
Yeah. We only have a minute left. I'm trying to think of all the questions that people ask. Oh, heart palpitations and crazy
progesterone.
And you think you're having a heart issue, right?
That's what happens, yeah.
Crazy. All right. So, gosh, that's it for us. I can't believe how quick it went. A big thank you to Dr. Roxanne Carfora, founder of the Ageless MD office in Long Island, for coming on the show. Guys, you have to see her. You have to go see her if you're having any issues or want to get everything running smoothly. You've been listening to Secrets of Powerful Women. Head to Powerful Women USA or Spotify to listen to previous shows. You can connect with me also on Instagram. We're going to repost this, and I think we're going to do some sort of series with Dr. Carfora because all this information needs to get out and accessible to everyone. I'm Jill Conway. Thank you for listening to the show Celebrating Incredible Women. I hope you are inspired to pursue your goals, believe in yourself, and dream bigger. Your voice matters, and your story can help others. I hope you join me next time.
Thank you, Jill.